This webinar. Again, it's my pleasure to be moderating this exciting topic. My name is Nasreen Jessani, a senior researcher at Stellenbosch University and associate faculty at the Johns Hopkins School of Public Health. A long-time acquaintance and friend of the AEN, so congratulations to the AEN for celebrating 10 years. It's a great milestone. With me today is, I've got three esteemed panelists, Laurenz, Mahlanza-Langer, Jennifer Opare-Kumi, and Patrick Okwen, all bringing very different perspectives to our session today. So I'm going to start with first introducing you a little bit to who our speakers are, in the order that they'll be speaking, obviously not in the order of the excitement or importance of their topics. So, Laurenz is the Executive Director of the South Africa Center for Evidence, based here in Johannesburg. He specializes in the production of evidence synthesis and in the design of institutional knowledge systems to support the use of bodies of evidence by decision makers. I'm sure anyone that's familiar with the Africa Center for Evidence, where Laurenz was based, but also with the AEN, is very familiar with his name and his face. So I won't say too much more there. Patrick Okwen is the team lead at eBASE Africa. He has a background training in medicine with a keen interest in EIDM. And if you yet don't know what that acronym stands for, then make sure you stay with us for the remainder of this conference. So he is active in EIDM capacity building in the Lake Chad Basin for policymakers, practitioners, and citizens, where he uses innovative approaches to improve livelihoods, especially for underserved groups. I'm sure Patrick can talk to us day and night for weeks on end about all the work that he does, but today we're going to hone in and hear a little bit more about mutual learning from him. He's also part of a team currently developing guidelines for reporting observational studies, for those of you that know the STROBE guidelines. And he's also, congratulations again, for being a past Evidence Leaders Award winner in 2018, and he has carried that leadership throughout the AEN all the way through these last 4 years. So thank you, Patrick. He is fluent in French and English. And for those of you that might share this, he loves gardening and collecting plants from across the world. So at some point, Patrick, you have to tell us how these plants from across the world grow in your environment and what's the mutual learning about a different ecosystem that you're dealing with when it comes to mutual learning and innovation. So maybe we'll veer into that a little bit if we have some time. And then last but not least, Jennifer Opare-Kumi is an applied social scientist who's driven by a passion for, again, EIDM. Hope you all know what that stands for. She's a doctoral researcher at the Blavatnik School of Government at the University of Oxford, where her research focuses on ways to improve education and mental health outcomes. So a very unique perspective that she's bringing, particularly for young people in the global south. Another interesting fact, she used to work for an evidence-led NGO, supporting government efforts in improving foundational numeracy and literacy amongst young learners in Botswana. And this ongoing work directly informs her education policy and priorities in the work that she's doing right now. So welcome again, all of you, to today's webinar. Thank you for your time, and we look forward to your insights. So Laurenz, I'm going to start with you, and I know you actually have a question for our audience before we launch into what it is that you want to share with us. So I'm going to hand the mic over to you.
Thank you so much, Nasreen, and thanks for having me. It's really exciting to be here, I have to say. It's breathtaking, 10 years of the AEN, what has happened, so much work, so much learning, so much innovation, and yeah, I don't know. Time has really flown. It is just quite something, and yeah, going through the program and I think reflecting a little bit, it's hard to pick out just one key learning, I would say, amongst many innovations and the many interesting initiatives that have been happening. But so the one item I'd like to zoom into, and that's hopefully whether it will happen with innovation in the chat, is around the depth and breadth of the African evidence ecosystem. So I think oftentimes we underestimate how much work there is going on. And I think that is really, over the last 10 years for me, the key learning, that we have learned how deep the African EIDM system is, how diverse it is, how many organizations, how many initiatives, how much capacity there is, which is often a bit contrary to the narrative that there are capacity gaps, so that there's lots of support needed. I think we, in the last 10 years, have shown how vibrant the African evidence ecosystem is, and the AN has played a big role. So, for example, among other, we a couple of years ago had to look at how many organizations are working on EIDM on the continent. And I hope that works. So I'd be curious to know from the audience, how many organizations do you think work on supporting EIDM in Africa? So I believe this question will be put to you in the chat, and feel free to have any guess. There's no right or wrong answers. And then hopefully at the end of the session, we can come back to and see how close the guesses were. When we ran this exercise, we were absolutely astonished how many organizations there were. So that just as a little hint.
So there is a right or wrong answer then, Laurenz.
No, that is, I mean, it's outdated data, right? It's a couple of years ago,
okay.
Yeah, but I think really, to me, that's the key learning, how vibrant this field is. But there's also, I think, a slightly cautionary story that I'm not sure we have tapped enough into this wealth of activities on EIDM and exploited its full potential for collaboration and cross-learning. And I quickly wanted to give two stories here. So the first one is with actually colleagues from ACRIS, the African Center for Responsive Evidence Synthesis, led by Rona Mujumbi. Unfortunately, can't be here today, but I believe she's on the plane to come physically to South Africa. And so 4 years back, we knew that Rona and her team did amazing work on responsive evidence services for government. And there was a big gap in South Africa on this. And we didn't know how to do it. We just knew that the Ugandans had this amazing methodology on creating evidence rapidly and making it relevant for decision makers. So Rona and her team came and had a series of 3 learning exchanges together with our government colleagues. And 4 years later, we've got an institutionalized, government-run rapid response service that has led to numerous policies being informed by evidence. And that is really only because Rona's team managed to share that innovation with us here in South Africa. And I think that's amazing. Right? That's the power of collaboration and cross-learning. However, the second story doesn't quite yet have such a happy end, and it actually links to Patrick's work. So we also know, for at least 4 years, that Patrick's team has this amazing methodology for evidence-based storytelling. And likewise, our government colleagues have been knocking at our door and been saying, well, please, can we make sure we learn how to do that in a South African context? Because we believe it has so much power and potential to increase use of evidence here too. But Patrick, and I know you agree with me, for 4 years we've struggled to get this exchange on the ground. So COVID came, kind of destroyed our traveling plans, and we tried to do some online sessions, but storytelling online is much more difficult than in person, and getting kind of a contextualized experience has been tricky. And then I'm really glad, Patrick, that you and your team are coming in November finally to give us a first-hand experience. But that is a story of where we know, in many instances, that there's so much to learn from other contexts, and we haven't yet fully managed to exploit that properly and to implement it in our own context. So, yeah, so in short, I think the depth of the evidence ecosystem allows us to learn and share so much, but I'm not sure we're fully exploiting that yet. Thank you.
Thanks, Laurenz, and that's really fascinating. What do you think is the reason for the suboptimal exploitation, as you refer to it, of these different innovations, different opportunities for learning?
Yeah. So I think I'd have 2 thoughts. So one is, first of all, is about knowing about it. So I think oftentimes we still lack a coherent language approach to describe similar activities. So I might be running a mentoring program with local decision makers here, and somebody in Morocco might be running a similar program, but we might use very different languages to refer to it, like from the terminology, is it mentoring, or is it training, or is it secondment, to the actual language in which we publish our work. So to me, there's a big gap around having a kind of a portal or a hub where we know about all the activities that are happening in a standardized manner. And I think the AEN has done great work showcasing initiatives, but having the standard framework to understand where we have similarities. So that would be the first one. And then I think the second one, unfortunately, is structural inequalities, particularly regarding logistics. So having the funds to fly quickly from Cameroon to South Africa and vice versa. Having basically the resources at hand to support collaboration. I think oftentimes we find it easier to get resources to start a new initiative rather than getting resources to learn from somebody else to implement what they've done in our context. That would be my two thoughts.
That's fascinating. And I would love our other panelists to kind of reflect on that question and have some thoughts on that. But over to you, Patrick. I'd love your reflections on your experiences with mutual learning and innovation, but also to reflect a little bit on Laurenz's frustration on trying to adapt what you've been doing in terms of storytelling and innovations in that area for South Africa. So over to you, Patrick. We can't hear you, Patrick. You're still muted, unfortunately.
Sorry, I was talking to myself. So thank you very much, Nasreen, for the kind words, kind introduction, and thank you, Laurenz, for introducing the discussion. Yes, when we talk about mutual learning, I mean, the code name of Africa Evidence Network can really tie very well to it because, as we said, working in silos would not let us progress. And I remember when I first came on board this journey with AEN, it was when we shared a stage with Ruth in Cape Town. And of course, we were going out to Cape Town, looking for places to share what we were doing and looking for new things to learn. And I think Ruth and I were battling between two African proverbs or stories. And one was that if you want to go far, go with others. I mean, if you want to walk quickly, you can walk alone. And I was bringing this story of if you think that you are too small to make a difference, try sleeping with the mosquito in the same room. So these were two concepts that really brought the two of us together. And then I moved on to the Africa Evidence Network boat. And since then, it's been an exciting journey. And yes, we had innovations that we had been grappling with. And in particular, our interest was not just empowering policymakers and practitioners to be able to make informed choices based on research evidence, but also looking at citizens, the public, those who are not science savvy. And the paradox here is that these people the public and those who are not science savvy, those who are not literate, are the crucible in which research evidence has to actually be making its impact. But unfortunately, we tend to look more at the policymakers and the practitioners. And storytelling was turning out to be the best way we could communicate research evidence with this target group. And it also does the same for policymakers and practitioners. But it has a way that it really gets it to the citizens, the public, etc. So, but we have been struggling with this innovation for a number of reasons. Getting an innovation up and running requires funding. It requires capacity to develop the innovation. It requires capacity to be able to write proposals to get the funding. It requires capacity to be able to disseminate your results. And this was where perfectly we were able to fit with partners within the African Evidence Network to build our capacity. And over the past 2-3 years, based on what we've been doing within the network, there's been interest from donors. There's been interest from the African Center for Evidence. And as Laurenz already mentioned, we are talking already with the government of Western Cape, and we are putting someone actually working on a PhD topic just for storytelling and implementation of research evidence. So this are my first discussions on mutual learning and the innovation we have been working on. Thank you.
That's really fascinating. Thank you, Patrick. And I think this idea of going back to our roots of storytelling. I think all of us remember all the stories sitting around fireplaces growing up, or grandmothers trying to feed us. I remember me, I was a terrible eater, and all my grandmother would do was tell me stories so that, in the half an hour, I would finally eat my food. And I still see that with my daughter today. So there's a real power in storytelling, not just for feeding children, but obviously in terms of advancing evidence-informed decision-making. And it's really fascinating to hear how that's being recognized, how the power of that is being now appreciated by funders as well. And I think globally, we're trying to see that more with the TED stories, TEDx. There's the Moth, just a huge movement in terms of the power of stories. And it's really great that you're now embedding that also in PhDs. And something I think, as we talk more about mutual learning and advancing the EIDM ecosystem, we have to start talking about those structural issues you mentioned, Laurenz, is how do you encourage and capacitate ethical review committees and IRBs to recognize these as valid and rigorous ways of research and dissemination. So I think we'll pick up on that again, but that's really helpful and useful to hear. Thank you, Patrick. Jennifer, over to you. Would love to hear more about your experiences on mutual learning on the continent. You're now based in the UK, but also in terms of a very different field that you're coming from. So the mic is yours.
Thank you so much, Nasreen, and congratulations to AEN for 10 years. Laurenz for setting the scene so wonderfully. And Patrick, as you were speaking, I was just thinking about exactly what you're saying is how compelling narratives are and how compelling it is, that so much so that sometimes a lot of the EIDM work is trying to get people to shift from a narrative into another one. The stories that we tell ourselves, that we need evidence to show that, actually maybe we can tell ourselves different stories. So I think, I'm really, really fascinated by the work that you're doing, and would be really, really keen to hear what comes out of the PhD research that has been recently commissioned. So I think with the scene that has been set, it's really nice for me to go specifically into one one sector. I would like to talk about education and mutual learning in the education space, what we've been learning, what we can still learn, but mostly in the context of how we are exchanging lessons and thinking through mechanisms that are behind what we are learning. So a lot of some of the challenges that we are talking about that I hope we can talk about is also, if something has worked in one place, what do we need to know? What kind of information do we need to know to know if it'll work in another place? So some of these questions I'd like us to be thinking about in the back of our minds, thinking through mechanisms, thinking through pathways for change. And specifically in the education space, just to set the scene from where we are coming from, that I think anyone familiar with education at large will know that, there was this huge global push with the Millennium Development Goals that said, let's achieve universal primary education. So we saw all our African countries pushing to get kids in school, access to primary education. And in fact, that was largely successful. We had numbers tripling, almost 90% in terms of access into education, schooling. Access to schooling became a measure in which we were measuring education. And by that, we were largely successful. Unfortunately, where we fell short was that access to schooling was not access to education. So we almost misunderstood the assignment in that we got kids in school, but kids weren't learning. So now the international education community would term it, quote unquote, a learning crisis, such that we have children in school, but we don't have quality education. So we see the move now again towards the SDGs, which we can talk about the challenges there, but now a movement from access to quality. So how do we get kids in school, and how do we make sure that kids are, when they're in school, they're actually learning? So there have been a number of innovations, interventions in multiple African countries that have proven with some level of success. And there are two that I would specifically want to talk about that I think the evidence supports it, and policies are not quite in line with the evidence that is supporting some of these systematic and systemic actually changes that are needed in the education sector as a whole. And the one quite intuitive one is mother tongue education. So there's a large body of evidence that shows that when you first are introduced to school, the language, your mother tongue or your proximate language, meaning your sister, whatever is close to your mother tongue, if that is the language that you are introduced to schooling in, it'll be much easier for you to comprehend. I mean, I think this is quite intuitive. Unfortunately, a lot of our education language policies in multiple African countries mirror our national language policies rather than actually having a separate education language policy. So what we see is in English-speaking countries, of course, we mirror the colonial past and having English as the national language, but also English as the education language. And then multiple countries, English-speaking countries, will be transitioning between year 4 and year 6 from mother tongue to English. And the question is whether that's the optimal timing. French-speaking countries, similarly, sometimes even earlier. We have cases where countries transition as early as year 2. So the challenge in that space is thinking around, how our national education policies are different to our the evidence base around mother tongue education, which shows that, if you're teaching kids in mother tongue up to 6 years, the evidence shows that it improves learning, not just in the short term in schooling years, but also long-term adult literacy, as well as other civic engagement outcomes. Another really key example in the education space is targeted instruction. We have in primary education, less than 50% of children by year 5 not having any foundational numeracy and literacy. So this is a grade 5 student who can't read a sentence. This is a grade 5 student who can't do addition, something that would be a minimum curriculum expectation in grade 3. So what are the policies in place that are addressing that? One innovation that has come from India, that is in 10 African countries right now, from Botswana to Zambia to Kenya to Madagascar, that is to Cote d'Ivoire as well. Yes, that's proved largely successful. It's an intervention that's called teaching at the right level. And I can talk about that later on as we discuss, but simply the innovation is in the title. If we teach kids at their right level, we can help them move from A to B. If we understand, first of all, what level children are at, then we can group them according to their various levels, and we can target instruction and support them along their learning journey. So, of course, I can get into more of that, but I think these are two interventions that have proven to have a pretty strong evidence base in education, but policies in our various African countries don't always support some of these, this evidence base for these two interventions. So two things that I'm thinking about now that I think we can think about as well is when we are thinking about mutual learning and innovations, whether these innovations are problem-oriented. And by that, I mean, there's so many things that have proven to work, but are we leading with the intervention or innovation? Or are we leading with the problem? As we go into multiple countries, I would actually love to hear, Laurenz, what the global evidence says about this. But if we lead with the problem, then we are more likely to be adaptable to that rather than leading with the innovation. By leading with the innovation, you're like, okay, this has worked here, so we're just going to carry this innovation into Botswana and just, roll with it. But we all understand that context is everything. So just thinking a little bit also about context and thinking about assumptions and mechanisms for change. I'll stop here for now. Thank you.
That's really fascinating. Thank you, Jennifer. And thanks for bringing a very different, perspective to the EIDM ecosystem. I come from a health background and I'm always inundated by health examples. It's really great to hear also from the field of education. And I love the way that you kind of framed it in terms of what's leading us. Is it the innovation or is it the problem for which an innovation could be useful, and which of the many innovations out there could be relevant to our particular problem in our particular country? And I really love that. And I think when you were talking about the example from India in these 10 African countries, it would be great to hear. Were they problem-led or were they innovation-led? But also it comes back to Laurenz's point earlier about language. I mean, what you described as teaching at the right level is called differentiated pedagogy in other countries. It's a completely different terminology, it's a different language, but they mean the same thing. And obviously the questions around that is, what does that mean for what we traditionally think about grouping children based on their age versus grouping children based on their ability? And what does that mean in terms of how they advance through an education system? So I think these are all really, really interesting questions. I have a passion in the field of education too, so I would love extra conversations outside of this webinar, but I think that's what mutual learning is all about, right? And here we go, case in point. But I think you've all brought up some really interesting points, and I think I'd like to ask Laurenz and Patrick, both of you, well, all three of you, you've given us really great examples of innovations from one particular context into yours. But by default, the assumption in the word mutual is that the learning goes both ways. And so I'd like to ask you, for the examples that you gave, the rapid synthesis example that we've adopted here in South Africa, what has ACRES been able to adopt from us? Where's the mutual learning there? And similarly with the work that you're trying to work with eBASE, Laurenz. And similarly for you, Patrick, as you talk about the innovations in storytelling and being able to bring that to South Africa, anything that you've, from the partners you've worked with here in South Africa, that you've been able to feel, oh, this is something that we can perhaps, adapt or adopt, context, as we all know is so important, into our, into our context. So, and same thing for you, Jennifer, there's great examples that you've given. I want to dig a little bit into the mutual part of the learning versus the unidirectional aspect that you've all described. So, Laurenz, over to you first.
Yeah, no, thanks. It's a really good question. I think it's a pity that we don't have Rona here, but I think most of you would have seen her speak earlier. So, no, I think she's a bit of the godmother of evidence-informed decision-making in Africa. So she has a lot to teach. I'm not sure how much we're bringing back to her. She's definitely a big inspiration for us. But I hope her and her team will not be too grumpy with me if I say I do think that the mutual part was around the methods of evidence mapping. So in South Africa, because we work outside of health, and Rona's team, I think, historically started in health, even though they're now very much in all social systems. The model that we jointly co-adapted in South Africa assumed that there was lots of systematic review evidence in place. And that's unfortunately not the case in many social systems areas, particularly at the national level. So the government of South Africa and ourselves, we have a methodology around policy relevant evidence maps, which is kind of interactive evidence databases. And so we use those maps rather than systematic reviews as a springboard for the rapid response services. So might be a bit of a geeky answer, but I hope that is something that Rona and the team would agree with, that there was a mutual part. I think on the storytelling, I defer to Patrick. I think we're very much still at the early stages in a lesson learning relationship. So I'm sure he has more to say on that one. Thank you.
Thanks, Laurenz. Patrick, you're muted.
Okay, so thank you, Lauren. I think, yes, as you rightly said, for the storytelling, we are kind of at an early stage, but I do believe that there are already some lessons we are learning from both sides. We have created a platform for this learning to happen, and I think it's the most important thing. I mean, for the concrete kind of learning that we want to see, which is in the different capacity building concepts that we have developed, partnering with the government of Western Cape, bringing on board the policymakers from Cameroon. I think in the trip that we are making in November to South Africa, we are going to be coming with the Commissioner for Health at the Assembly. And this will be an opportunity for her to explore how policymakers work with researchers in that light. And it would also be an opportunity for us to share with the policymakers and the researchers in South Africa how how they are working, how we are working with storytelling and policy for citizens, policymakers, etc. But also, I think the fact that we have also created this PhD program specifically for the work that we are doing really highlights the fact that we are exploring how we can learn from this approach. In essence, the PhD candidate is a traditional storyteller who started working with eBASE. And when she came up to eBASE, she was an undergraduate student. And we moved on to a master's program based on the storytelling and funding that we received. Then she is now moving on to a PhD program. And it's really something that is new for traditional storytelling or a traditional storyteller moving up this ramp. And what this tells us, and when you look at how some of the principles behind storytelling, for example, the storytellers used to say that you cannot tell a story to an audience that you do not know. So before you tell a story, you have to know that audience. And we have been aligning this knowledge of the audience to the trans-theoretical model, understanding the community, what stage they are in change, because every research evidence that's coming is coming with a new technology. And these people usually would be at different levels. For example, if you bring a COVID vaccine, it's a new technology. And people may be in denial, people may be in pre-contemplation, people may be in action, they may be at different stages. And this may actually be what the traditional storyteller was talking about when they said you need to know your audience before you can tell them a story. So we find a situation where we are opening doors for the mutual learning to happen in a well-structured, a systematic, and a rigorous approach. And this is, I think, how far we are going so far, and we are at the early stages. Thank you.
No, that's fascinating. And I think that's what innovations are about, right? It's the early stages, we're still learning and taking risks, which I think is also really important when you think about innovation, particularly in a really interesting field of mutual learning. Thanks for sharing that. Jennifer, did you have anything you'd like to add, particularly as you were thinking about contexts and relevance?
Yes, definitely. But before I just jump into the mutual learning bit, I just wanted to clarify, seeing as we are being very specific on language use here, in terms of what I'm going to give the example with teaching at the right level, the targeted instruction intervention, how that's very different from, for example, tracking, which it can sound like that, where you put all the kids that are, for example, all the A-star kids are in one class, all the B-star kids are in one class, all the C-star kids are in one class, and they continue to be in the same class, hence they're tracked along the way. That's very different from this targeted intervention or this approach, where it's for a shorter period of time within a school day that the kids that are at the same ability level are being taught a certain thing to get them up to the curriculum standard to reintegrate them back into their class. So I think that's a very key distinction to understand why this is actually an innovation and not something that's going to cause them maybe some long-term actual mental health distress as they see that there are different levels with their peers. But in terms of mutual learning, I think what is key here with the interventions such as teaching at the right level is that between countries, what has happened so far is that there has been a lot of various country visits. So for Botswana, for example, has hosted visits from NGOs in South Africa, in Cote d'Ivoire, in Kenya, in Zambia, to see how teaching at the right level operates in Botswana. Similarly, the groups in Botswana, practitioners, NGOs, as well as government officers have then traveled to Kenya and to Zambia to observe how teaching at the right level happens there. So mutual learning has a lot to do with contextual adaptations, how they decide to group students. So a very, very specific, but to give us an idea example is in some contexts, students are grouped by if they understand the difference between, if they can do addition or they can do multiplication or can do long division or multiplication, whereas in other places, students are grouped by if they can recognize a single-digit number, a double-digit number, a three-digit number. These seem like minute differences, but actually make such a huge impact on how teaching is then structured and how the facilitators or teachers then iterate on their learning and teaching material. So there's a lot of contextual adaptations there that different countries are learning from each other, whether to include an icebreaker at the beginning, middle, or end. These are very minute details that make a huge difference to a child's learning environment and thereby impacts their learning outcomes and their experience of schooling as a whole, which when we think about education, it's not just about, as I started, it's not really just about access to schooling, it's then about the quality. And the quality is not only in your outcomes, it's also in your learning environment, in the schooling environment, and how we want to think about how we are socializing individuals in the world that we want to live in together. So yeah, that's what I'll share about mutual learning.
That's really fascinating. And it sounds like there is a very focused and determined view to understand this while it's being implemented. Is there an implementation science, implementation research component to this that's allowing for that that documentation, the learning, the adaptation? And is this something that all the countries in some ways create some kind of community of practice around?
There is absolutely, sorry to just jump in and answer that, but there is a community of practice around this, which I think is essential and something that I wonder if that's happening in the wider EIDM space when we think about how much funding goes towards outcome-based interventions versus process. Because a lot of this, thinking about external validity issues, is thinking about, will it work in my context? We need to understand process. We need to understand why it worked in the first place. What was the theory of change? What were the underlying assumptions? And will they hold in a new context? So a lot of these questions, I think we are learning on the ground. So it's a lot of action research, and the openness with which countries are sharing with each other is the extent to which learning can take place.
Absolutely. No, that's fascinating. And I think that's a great thing to be sharing on a forum such as this. I think there's lots to be learned from that, not just, like you said, intervention outcomes, but things like implementation outcomes, the whole process aspect of it. So that's fascinating. I'm wondering if we're at a good point at this time to see if you have questions for each other to clarify what was said, but then also open it up to questions from our audience. Otherwise, I could monopolize all the questions with your interesting stories here. So I don't want to do that. So I'm wondering, Laurenz, should we see how the poll went and what kind of answers we got? But before that, did you each have any questions for each other? I want to give you the first chance at that. Laurenz?
So I'm actually curious from Jennifer's perspective. I think it sounds like your model is very advanced when it comes to understanding how to transfer across contracts. And I'm trying to think, so what would be the pendant to teaching at the right level be in the EIDM intervention world? So which is the one evidence-based intervention that we know supports the use of evidence across context? And then what can we learn from you on how to get that across context? So sorry, this might be two questions. The first one, which would be the equivalent intervention? And then the second one, how do we get it across context? So my personal bias would be Patrick's and Rona's model that I've mentioned. So let's stay with Patrick. The evidence-based storytelling to me is an approach, an evidence-based approach for an intervention that we know supports the use of evidence. So now what is your advice? How would we get that across context? Because in a way, we got lucky. We learned about Patrick's work and then we managed to design a program around it, but it's not very systematic, right? It's not how you mentioned it, taking the intervention and bringing it to 8 countries. So that would be my one question. I kind of wanted to have questions there. Nasreen, I'm not sure if you wanted to go into it.
No, I think that's a fantastic question. So Jennifer, if you have a response to that.
I have a response, but also a question where it requires us to workshop it together. But I was thinking about the storytelling intervention as well, and I am fascinated. And I wondered if we could almost live shop the theory of change behind why it has been so successful. Patrick can tell us a little bit more about, what were the initial beliefs that were held before the storytelling intervention, and then what was the change afterwards. If we can track that, what happened in between, because I think a lot of how my reading of the evidence anyway, of how evidence is translated from one context to another, is really understanding the why behind why it worked in the first place. Because then otherwise it becomes like a success wonder. We're like, oh, this was amazing. But then how do we do it at scale, whether in the country or at scale in other countries in similar contexts? And by similar context, it could be that the problem is read differently. I remember, Laurenz, you said earlier, our understanding of language on what is mentoring versus coaching versus teaching. Maybe we're understanding the same problem, but we're calling it different things. So if storytelling is already something that is used in in South Africa, storytelling is not a novel idea, but maybe how it's being framed or introduced, what exactly is it that has been successful in the case study that Patrick has presented us that we can learn and then translate? Are the same problems existing in the South African context that we also are trying to solve with that storytelling would solve? Maybe there's something else that needs to be adapted in the storytelling. So this seems like something, I'm not answering the question, but I think my answering of the question is that I think it's to understand more that we need to live workshop and just try and understand the theory of change behind this very compelling innovation.
Okay, so thank you very much. And very interesting the way it's going, because I'll talk a little bit about storytelling so it can respond to Jennifer's curiosity. But I will also come back to Jennifer on something that she mentioned earlier on what are the components that can make us predict that evidence from one context can be used in the other one, especially because this could be a huge economic factor with respect to research. It could save a lot of money for research, etc. But first to the storytelling. I think when we started the storytelling concept, it was flowing, everybody loved it, probably because storytelling can be non-confrontational, can be entertaining, while it's being educative at the same time. It could also evoke emotion, and human beings are generally emotional beings. And sometimes the white and grays of research may not exactly connect with them. But of course, those are the theories. And so when we developed the concept, we were lucky at the first stage to get some funding from the French embassy in Cameroon to really further develop the concept and come up with a tidier document that could facilitate anyone who wanted to replicate this concept in another context or in another setting. Let me not say context, in another setting, could just take that document and use. And then after that, we were lucky to also have some funding from the Grand Challenges Canada to pilot the intervention. So based on the tidier document, now we were able to investigate the acceptability, the feasibility of the approach. And with that, we started looking at the theory of change. And the theory of change, of course, expects that it all has to do with diffusion of a scientific evidence or an innovation. On one hand, for example, a vaccine comes, they need to diffuse, because most of the time, one of the reasons why people will not take up a health or an education technology will be because they lack the knowledge, they don't know about it. And a very interesting comment from a prominent African storyteller, Ben Okri, he said that the human mind can only see what it has seen before. So in essence, if you bring a vaccine, technically I haven't seen the vaccine, so I don't trust the vaccine. But when I see it through a story, it improves my knowledge, and I begin to conceive what a vaccine can be. I begin to conceive the fact that in the life of a character who didn't take the vaccine, he suffered a complication, or the life of a character who took the vaccine, maybe he had a lighter form of the disease. So some of this kind of understanding plays with the human mind, improves the knowledge. It also improves intention. And from that, it can improve behavior. We do understand that other things also need to be around. For example, if people say that, yes, we want to use mosquito bed nets, but they don't have mosquito bed nets, they still will not be able to use this mosquito bed net. So these are some of the theories that we are developing within the storytelling event. And our hope is that, and this is one of the things we are working with Laurenz's team, we would be able to get funding for a bigger project, and which will also, within this PhD program, we will be able to better understand these theories behind traditional African storytelling approach and how they interact with science. And then coming back quickly to what you mentioned about what is needed to move evidence from one setting to the other, or one context to the other, or how can we predict that this can happen? And this is a question that really came up, because when you do a review or you take up a guideline or evidence recommendations from a study that was conducted in the UK, the question is, why do we think that that can be used in our context? And so we started exploring predictability. We started looking at how can this be transferred. And with funding from the SEDIL program, we're able to start picking up some ingredients. And we've developed a tool called the transferability tool, which we have been using, but it's something that needs big data to be able to really evaluate. So I would be happy to pick up with you, Jennifer. I'm sure we can spend the whole day talking about this kind of components and predicting transferability. So I'll be happy to talk a little bit more with you even after this about this kind of components. So thank you. I think that's another opportunity for mutual learning. Thank you.
Absolutely. It's nice to see all those sparks happening. And I love the discussion about putting some rigor behind indigenous forms of EIDM, because I think that will give it the legitimacy it's always deserved. But given that we work in a field where it's about evidence-informed decision-making, to kind of prove with evidence that this is an effective form of influencing change and action, even down to the citizen level. And storytelling is only one of many that are used, right, in our context. Dramas and plays are really important in some of our communities, songs, and they all have different kinds of impacts. And I remember, and it's interesting that you say it was funded by Grand Challenges Canada, because several years ago, almost 20 years ago, another Canadian organization, IDRC, had funded really great dramas on equity in the healthcare system in Zambia. And it led to massive change in terms of health policy, but it came through dramas and plays in the communities. And so I think it's really great to be celebrating these forms of communication, but also to be putting data and evidence behind them and their contextual relevance, for them to be able to sit at an equal table with other forms of communication, dissemination of evidence for decision making. So I think that's really been really fantastic. And thank you to all of you for sharing such insightful examples, but also sparking many more opportunities for mutual collaboration, truly mutual collaboration. And I think many will be inspired, those that were if anyone could post it for us in the chat here or on the other platform. If Laurenz, if you can see what those questions are, I can't at the moment. That would be great so that we can have our panelists respond. So Siziwe or Kyle, is there anybody that can help us understand what's happening on the audience platform, please? So I unfortunately have load shedding where I am, but I know that, Laurenz, you are tapped into both platforms. Is that right?
Yes, I'm not sure if I have full access because I'm a guest on the other side.
Okay. Kyle, is Kyle with us? Can one of our colleagues please assist?
Hi, we just went off for a few minutes. We're back online.
Sure. Lovely.
Okay, but I still see the session is still on.
Do we have any questions?
Thank you, Mark.
Okay, we only had the answers and responses from the question that Carl posted in the chat discussion, but nothing else other than that.
Okay, so I'd like to ask colleagues, maybe we hadn't invited you all yet to submit any questions. Please, if you have any questions in particular for the examples that Patrick, Jennifer, and Lauren shared with us, please post them in the chat and our conference colleagues will share those with us. But if you would also like to share an experience of mutual learning, please do make a point in the chat and we can offer you the mic to be able to share that with us. And if you're not speaking, if you can please mute your mic, because I think we have a little bit of background noise. So Patrick and anybody else that might still have your mics on. So while we're waiting for some questions to come through, I think let's think about what would be our way forward. So we've heard some really great ideas about mutual learning. We've also heard about some challenges, and some of those challenges included, the legitimacy for these forms of learning, financing, finding appropriate funders that are willing to take a risk on these kind of innovations, and also finding opportunities for this kind of dissemination. So if we want to advance, and the AEN definitely wants ideas for this, if we want to advance in terms of encouraging mutual learning on the continent, what suggestions would you have for practical solutions for being able to do that based on your experiences? So this time I'll start going backwards, maybe start with Jennifer and then Patrick and then Laurenz.
It's a tough question, Nasreen. I'm thinking about the practical side of it. What can be done practically? I think a lot of the challenges, even around financing, and financing even in a new context, a new country, new environment, has to do with adaptation. Adaptation takes time. So I wonder how much we can help each other by creating open source tools. So education is one that I simply revert back to because it's the easiest for me to grasp. But by open source tools, what I'm referring to here is if we found maybe a certain set of formative assessments that are particularly effective, having scaffolded teacher lessons and plans that can become open source rather than tied to a certain institution, organization, brand, funder, that then other countries can basically grab the template and then adapt as needed. So sometimes the big cost is then like trying to figure out how will I make this work in my country. But if we had some really open templates, then we could have, I think a lot about what scaffolded support looks like in different countries. And it starts with just having some kind of framework as to what we're talking about. If we can have a template, then you can fill in the blanks. So I don't know if I'm speaking in riddles, I hope not. But I think open source templates could help in whichever field or industry we're talking about.
Thanks, Jennifer. And I know it's not an easy question, but definitely one of those wicked problems we do have to be grappling with, because we're also interested in mutual learning, in continental learning, and you even talked about our colonial history. So how do we decolonize our models of learning? And I think that's really important as we start thinking about practical solutions to advance on this. Patrick, did you have any thoughts?
Yeah, so I think when I think of the ways moving forward, I would first of all look at some of the ones that we are doing that are really good. And this includes like forums like this where we would sit and discuss. And it reinforces the indigenous approaches for communicating science and helps with decolonization, as you have just mentioned. And I think this is probably one of the strongest ways that we can move forward, because it provides opportunities for us to also reflect on capacity building opportunities, on funding opportunities, and a lot more. So I'll first of all dwell on what we are doing, which I believe is really working well. And it's really hard for me to think of new ways at the moment. So I think I would probably just stick on this one for now. Yes, thank you.
Challenging problems, Ray. But at least we're starting to think about it. Laurenz.
Nasreen, just to say, there's a couple of questions on the Q&A. Let me know if you want me to read them out later. Practical advice. The immediate one is, I think, listen to Patrick and Jennifer. I think they both have gotten really, really good practical ideas on how to move forward. I think particularly Jennifer, kind of the model of how do you know something works and how do you take it to a new context, and then the process of adaptation. So it feels like we have a lot to learn there. And then I might just add one intrinsic practical recommendation, so inward looking. So what can we do ourselves? I do think it's around not trying to do everything at once and looking where other organizations have built a path for you that you can then follow. So as Patrick said, working together, we can go further. So if somebody in a different context has already walked the path for you, there's kind of no need for us to reinvent the wheel. So if I'm an EIDM organization in South Africa and there's an established model for storytelling, I don't have to invest again to build it from scratch. Same when it comes to capacity building. If somebody in Ghana has cracked online capacity sharing, let's start there rather than try to build our own kind of ivory towers. That would be my contribution there.
Yeah, and I think that's a great value to have. I think it's also the same kind of ask we always have of funders and donors is don't create new institutions, strengthen the ones that exist. It's the same thing internally within Africa. We don't need to fragment the system even more, but support each other, enhance each other, learn from each other, and collaborate more. So I think that's really it's really great to be thinking about it that way. I see we do have a couple of questions from the chat that are coming through. So not easy questions. So, but you're the panelist, so you're unfortunately in the situation where you're being asked to see if you have a response. But I do encourage our audience also, if you have responses or ideas to the questions that are being posed by your colleagues, please do share those with us as well. So the first question is, how do we institutionalize mutual learning in the community of practice? And I think this is a great question for the AEN, because I do think that there's something that they are definitely striving towards, is creating these communities of practice, particularly for capacity sharing, but mutual learning is also a really important aspect of that. So the first question is, how do we institutionalize mutual learning in the community of practice? And then the second question is, what is the place of policymakers in ensuring the sustainability of constant mutual learning? And the third question is just coming through, but I'll let you sit with those two while I go back and check on the third one. Who's brave enough to tackle those first? Patrick.
Okay, so let me go. So I think to institutionalize mutual learning, we would first need to look inwards and ask ourselves, what can we put in place to ensure that we are being a fertile ground for our peers. For example, that I'm able to take up, or I'm able to allow what Jennifer is doing, say, in targeted teaching at the right level. How can this happen in my own setting? Or Jennifer is asking the same question about what I'm doing. In a healthy way, but not in a pervasive way that we are just allowing it to roll, in a situation where we can be critical about it, we can think through it, and we can allow each other to reflect on what we are doing in order to move forward. I think that would be one of the best ways to be able to institutionalize mutual learning. And as for the second question on the role of policymakers, I think they play a key role, especially in our African setting, because unlike most of the countries in the North, where you may have some form of private interventions that are pushing forward certain kind of intervention, this is kind of lacking in our environment. And most of the time, the government is still doing a lot of investment. And we do not know, I mean, the debate about whether this is the right approach or not is not for us, but that is what is happening. So it means that the policymakers play a key role in pushing forward mutual learning, in pushing forward whatever we are trying to do. And this is one of the reasons why in our mutual learning process, we are bringing on board the policymakers in Cameroon to work with the policymakers in South Africa to see how we can kickstart this journey with storytelling within the network. Thank you.
Thanks. That's interesting. Anyone would like to add to that, Laurenz or Jennifer, or provide a different perspective, given that your contexts are different about the roles of policymakers, but also in terms of institutionalization?
Yeah, maybe.
Oh, sorry.
Go for it.
I don't have much to add, so actually you can probably round out the discussion here. Just to agree with what Patrick was saying around the key role of policymakers, and just thinking around how we can include more policymakers in these spaces, in these discussions, in our communities of practice, because our underlying assumption here, of course, is that, mutual learning is what's going to take us forward. So if that is the case, and this is the positive outcomes we're already seeing and we are hoping to see more of, as is evidence-based and as is evidence-based of the whole evidence ecosystem, then we want to find ways to include more policymakers in the discussion to ensure that we are all speaking the same language, at least when we're talking about the same issues. Laurenz.
I think there's very little left for me to say. I agree. I think it should start with the policymaker. Like, the user of the evidence should be at the center for any form to institutionalize this. So I'll leave it there. Fully agreed.
Fascinating. With the storytelling discussion, though, it feels like the decision makers are not the policymakers. It really is about civic engagement and the use potentially of storytelling, but also citizen panels. And so at that point, I guess one would wonder, what is the role of community leaders in being a part of this ecosystem, and how do you empower them, and how do you get that kind of buy-in? I think somebody said earlier, we think too much always about policymakers, but sometimes it's where the rubber hits the road is with the citizens and with the everyday person. And so I think these are all really important points, but that we don't forget this is a very large ecosystem when we think about EIDM. And sometimes we're very narrow in the way that we think about who the users are. But that's why we're all in this together, to kind of keep reminding each other about where we are best placed to make that kind of input. I think we have one last question, and then we'll probably have to wrap up. So one question is, what are some of the ways or ideas that can aid in creating a conducive environment for learning? a tricky one. I don't know if anyone wants to take a shot at that. What creates, what can aid with creating a conducive environment for learning?
I might share one example that has worked well for us, but not to say that this is the only thing you should do. I think there's much more needed for a holistic approach. But first, being clear on the values from the beginning, and to start with the values rather than the infrastructure. So you can, for example, very quickly run to build a nice flashy learning platform, with inbuilt learning analytics, and that's good fun. Like, don't want to dismiss that. But I think being clear on what are the values that underline the learning partnership, and what are we learning for ultimately, and how that shapes the design of the then associated infrastructure. So that emphasis on values is something that we have learned that was quite important in our own journey.
I think that's super important. Just what is the bedrock of all of this, right? Thanks, Laurenz. Jennifer, any thoughts?
So thinking about values, I was thinking of another education example, if you're not tired of education examples yet. But in terms of alignment and aligning what is important, and it even ties in with, Nasreen, what you're talking about in terms of including community leaders and community in the first place. And when we started talking about a learning crisis, and that, parents started noticing, community leaders started noticing that, my child is in school, but like when they come back, they can't seem to tell me what they've learned because they're not actually learning anything. What happened in the case of India, and what we're now seeing happening in multiple African countries, is that actually parents took to the schools. Parents, older siblings, went to the schools to say what is happening, and not just blaming, but how can we support you? So the intervention actually started with parents giving up their time, community leaders giving up their time, saying that, the kids that are falling behind, why don't we take them on? Why don't we sit with them? Why don't we support them? Which sounds simply like tutoring, but in a more structured way, of course. So I think in a lot of these ways, when we think about values and alignment, is to say, everyone has a different function and role. What are we bringing to the table? How are we sharing with each other? How are we openly learning together, rather than blaming, we're here because of this, we're here because of that, but saying this is where we are now. How can we support each other to improve and to reach our goals? And I think that's what I'll share.
Super, thanks. The importance of alignment, but also community empowerment, right? This feeling that I have the space to advocate on behalf of my community or my children, I think creates that conducive environment. Great insight. Patrick, the last word with you before we close up.
Thank you. So I would say that the best way to create a conducive environment is to ensure that all the stakeholders within the ecosystem are involved from the beginning. And these, of course, as I earlier mentioned, we have the policymakers, the practitioners, the citizens, including the community leaders themselves. And we had a very interesting example of this, which showed when you bring in community leaders in one of the programs we were doing on sexual and gender-based violence, and how something as far away as climate change could actually be increasing vulnerability of women, because this causes floods, destroys farmlands, and rural women who were depending on this to feed their families or even to make money from the market no longer have a piece of land. And you see the way you can make this kind of evidence grow without people shutting it down is bringing together all the stakeholders and talking with them from the beginning, letting them know that we are trying to find a solution to a problem, and that one person's problem is the other person's problem. And from there, we can move forward. So this gives an opportunity for a concept or an idea to grow within the community. And I think this is what I would understand as a healthy learning environment. Thank you.
That's fantastic. Thank you. Great insights. We're approaching the end of our session. It went by really fast, as these kind of exciting discussions always do. I'd like to really thank Laurenz, Jennifer, and Patrick for your insights and sharing. This was all mutual learning and sharing everything that you've been involved with, and opportunities for growth in this area and some great ideas. So thank you so much for that. I'd like to hand back to Siziwe, perhaps, to officially close this session. And thank you to our audience for your questions. And we hope that these conversations continue beyond